Hello there, I'm John Turner and I was a patient participant in a diabetes core outcome set.
And I'm Laureen Smith, and I'm a patient research partner in a core outcome set for two of the most common of the rare inherited metabolic diseases, PKU and MCAD deficiency. And today, John and I will talk to you about how and why patients are inputting into core outcome sets, and highlighting also a few of the challenges and solutions.
Patients can input into core outcome set studies in two ways. Patient and public involvement, PPI, as public research partners helping, for example, designing an accessible core outcome set study for participants, or developing understandable participant information. Or as core outcome set study participants, providing opinions on important outcomes for research alongside other key stakeholders, using methods like patient interviews, online surveys, or consensus meetings. As core outcome set development aims to produce generalized knowledge, core outcome set researchers usually need to seek ethical approval. So is patient input in core outcomes studies actually happening? The data on the screen is from the end of 2017 and is from both published and ongoing core outcome studies. Gargan and colleagues found that of 307 published core outcome sets, 29% had some form of patient public input, either participation or involvement, as you can see from the blue shading. However, of the 223 ongoing core outcome set studies, 201 or 90% have some form of patient public input. So we can see that public involvement in core outcome set development is becoming increasingly more prominent. You might wonder what impact the patient perspective has in relation to core outcome set development. A couple of examples are the rheumatoid arthritis and chronic pain studies, both of which included patients at later stages after initial work with health professionals. Including the patient perspective helped highlight the additional importance of some outcomes not previously highlighted. I found out about the SCORE-IT study because I'm signed up with the Beat Diabetes project. Beat is an NHS project that connects research projects with those living with diabetes. I responded because I'm keen to help any project that advances our knowledge of this horrible disease. It worked through, firstly, a Delphi study. Round one, I was sent an online Delphi survey containing lots of outcomes for me to score with my view of importance. Round two, I received the same Delphi study, but with my previous scores included and the scores of the other groups, and asked to consider them all and rescore the outcomes. This was quite a long process, especially the second phase, but I found it fascinating to see the different viewpoints. I was then invited to a consensus meeting in Liverpool for further discussion about the outcomes. The meeting included a wide variety of people from different backgrounds, researchers, doctors, health professionals, those of us living with diabetes, and those caring for or living with those living with diabetes. The day was very well structured and allowed everybody to have a voice. We talked about the outcomes from the surveys, discussing whether or not they were the most important outcomes to be included in the core outcome set. It was a really positive meeting for me because the professionals showed a real interest in our views and took on board what we were saying. I felt that the meeting was really inclusive. Since I was diagnosed, I sort of became just someone with diabetes. But this process has empowered me to push back at this awful disease and allowed me to become a part of the solution. The whole process was inclusive and I gained respect for the professionals, and it helped me also to understand their viewpoint. Being treated with respect by the professionals and having my opinions valued by them was simply amazing. I am proud to be part of Diabetes UK's Grants Advisory Panel. It's a lay panel which reviews applications for research funding and puts forward recommendations to our research committee. In my role, I will make sure that my patient organisation and members of the advisory panel I sit on are aware of core outcome sets and why they're so important for research and about the findings of the SCORIT study. Developing and using core outcome sets reduces waste in research. Are you going to join this core outcome sets revolution to improve research? Are you going to make sure that there is no choice of outcomes about us without us? Now I'll hand over to Maureen, who will tell you about her experience of being a patient research partner on a core outcome set study, and a bit about some of the challenges of taking part, with a few tried and tested solutions.
Hello, everyone. Thank you, John, for relating your patient participation experience. It's great that it's been so positive. So as John mentioned, I'm Laureen Smith. I'm from Canada, and I'm a patient research partner involved in a core outcome set study focused on two rare inherited metabolic diseases, PKU, which on the next slide you'll see the full name of it, and MCAD deficiency. Same there. So I became involved in this project because I'm a rare disease patient who's on the board of directors of the Canadian Organization for Rare Disorders. Another patient research partner who is also involved is Nicole Pallone, and she is the mother of a child with PKU and also on the board of directors of the Canadian PKU and Allied Disorders Patient Group. Dr. Beth Potter from the University of Ottawa was the lead researcher on this study, and together, we devised the patient engagement strategy for our core outcome set. So in this core outcome set, it was the team of principal investigators who reached out to patient group members to become involved, but there is no reason that patient groups couldn't approach researchers to collaborate with them. So I've been involved as a patient partner for over 20 years now, and I've increasingly been aware that our perspectives are often missing from setting research priorities and determining the outcomes that will be studied. Are they meaningful and relevant to patients and caregivers? So it was an easy sell, but now how to make sure that we can meaningfully engage families as these outcomes are for children under the age of 12 in an area of research that is less intuitive, as it doesn't necessarily resonate as easily as other research studies. Stay tuned for how we actually did that. We tailored our patient engagement strategy to what we hoped would result in facilitating the participation of families in the process of selecting core outcomes, and we realized that this would be a challenge. I've already spoken to you about how Nicole and I contributed to the study. We also had our family advisory forum who provided feedback that enabled us to create effective recruitment materials and patient-friendly Delphi surveys for families to participate in the development of the core outcome set. There is no one who is better equipped to partner with on creating these materials than the patients or families themselves. And these families, who had been part of the process from the beginning, were valued participants in our in-person consensus workshop. So these are some of the challenges that we face. So just first of all, communicating the importance of core outcome sets, making Delphi surveys accessible for patients and caregivers, providing the patients and caregivers with easily understandable definitions for scientifically complex candidate outcomes, and concisely and clearly communicating Delphi results in a manner that facilitated the feedback from our family advisory forum. So some of the solutions that we tried out were to make sure that all patients' materials were written or vetted by patient partners. We provided in-person training to fully explain the importance of patient engagement in the study, the expectations for participation, and the core outcome set methods. The Family Advisory Forum received additional training in Delphi surveys adapted from the Common Initiative lay language materials, and the patient partners and Family Advisory Forum provided feedback on the design and content of Delphi surveys, including the preamble materials, and they provided feedback on the outcome definitions. Then we had specific challenges that were relating to our in-person consensus workshop, which is one of the very important to have meaningful participation of patients there. So if for many of our patients and caregivers, it was their first experience attending a research meeting with their child's physician in attendance. So in the rare disease world, this is going to be a common problem. So there's a power imbalance there. They were unsure of the process and or whether their feedback would be valued. We wanted to ensure that the members understood their role and managing their expectations and ensuring that the patients and families felt supported and that their perspectives were well integrated into the discussion. And our solutions for that were that the participants were given a list of all the workshop attendees ahead of time. So no surprises, they knew who was going to be there. The pre-workshop material was circulated to them to explain all the details of the consensus workshop. We had a pre-meeting for the members to meet the facilitator to review the workshop materials and procedures ahead of time. At the consensus workshop, we communicated to all stakeholders the value of the lived experiences of patients and caregivers in developing the core outcome set and how they had participated in the study. And we used a nominal group technique, so all participants were given an opportunity to speak. Well, in conclusion, patient engagement strategies are necessary to develop core outcome sets that are relevant to patients and their families. Patient groups possess the knowledge from lived experiences, the networks, and the passion that are all key to engaging in this area of research.